Broome and Tioga in themselves are very diverse. So we have the city of Binghamton also that goes to Whitney Point and Owego.
People are hungry to learn about how race and bias plays a role in their work environment.
HealtheConnections has really allowed us to expand our horizons and expand our reach and collective impact so that we know we are reaching more individuals, more community-based organizations.
Workshops feature some grounding work through data analysis of health equity issues in order to get an understanding of the healthcare landscape and disparities that exist in the Southern Tier. For example, in Tompkins County, African Americans experience premature death 63% more than whites, asthma hospitalization 178% more often, diabetes hospitalization 96% more often. In addition, African Americans have 240% more drug-related hospitalizations than whites. Poor economic status is often associated with poor health outcomes, as those without means are not in a position to make lifestyle changes that promote good health. One Blueprint workshop in Tompkins County had attendants participate in a poverty simulation similar to this one, also held that fall in Orange County.
Should everyone have the right to achieve their highest level of health? Does everyone achieve their highest level of health? No, the data shows that. So what gets in the way? They leave this workshop with a toolkit to operationalize health equity, and hopefully the leaders in their institutions will hear them and make a difference.
It's 8 o'clock in the morning, you just opened up.
I can't reimburse you.
Yes, you can.
Yes, you
I
can.
did not receive our service, you're going to refund me.
Yes, I know about the Section 8 vouchers, but unfortunately I can't help you with that.
I've never been evicted before.
But I don't have the vouchers available.
People were evicted, and that's the same problem we're dealing with where I live in my community. I got a glimpse of how they dealt with it.
I was so stressed. The person I played was a 13-year-old, and I got expelled from school, and my father was incarcerated.
I literally had stomach pain. You're working and you have to get around by public transportation.
I really think it's about making people live those lives so that they can serve their clients better and with more of that empathetic and, racial equity lens.
There are many organizations that someone that may have lived in Broome their whole lives may not know what's going on in Tioga. So having the opportunity to connect with one another is very important.
There are some very hard topics that are covered today, but I think people do leave here feeling hopeful and that they can make a difference.
We know that change takes change agents, and these change agents have to be champions.
The knowledge that I have, if I could share it with others, it's going to change their life, because it's changing my life.
That's a lesson well learned. And we're definitely going to talk about what we witnessed here today.
We create policy, systems, and environmental changes that will allow people to engage in behaviors that are good for them.